Hello and welcome to Local Health Now with Guthrie. My name is Christina Episcopo, and today we are here with Dr. McClintic. How are you?
I'm well, thanks.
Awesome. Today we are going to be talking about atrial fibrillation, or also better known as AFib. So can you tell me a little bit about this?
So atrial fibrillation is one of the most common heart rhythm problems that we encounter. It's an irregular problem with the top chambers of the heart where they sort of beat irregularly, the atria, and it can make your pulse irregular. It does confer an increased risk of stroke, and it can also lead to symptoms such as palpitations or feeling your heart racing, shortness of breath, sometimes chest discomfort. So it's an important and common electrical entity in the heart.
Okay, and so what are the risk factors of it?
Some of the most common risk factors for atrial fib are obesity, hypertension, coronary artery disease, and things like diabetes, obstructive sleep apnea, and there's many others, but those are some of the most common ones.
All right, and then lastly, how do you manage the risk factors?
So the management of the risk factors that lead to atrial fibrillation are fairly straightforward lifestyle things most of the time, such as maintaining a healthy weight, maintaining a normal blood pressure, trying to avoid excessive alcohol, which is another risk factor, and controlling diabetes as well. And then managing the atrial fibrillation itself if it is diagnosed, and particularly the most important thing is trying to prevent the advent of stroke, which atrial fibrillation does increase the risk for.
Awesome. Well, thank you so much for joining us today.
Thank you.
And thank you for joining us for Local Health Now with Guthrie. I'm Christina Episcopo. Have a great day.